Hi everyone, it's Dr. Gina Joe, or Dr. Gina Jefferson, Professor of Otolaryngology, Head and Neck Surgery. I'm going to answer the question posed to me recently about how to know whether or not otolaryngology is a good personality fit. Ultimately, you do not want to be in the situation of having matched into a specialty where you feel some degree of angst on a regular basis. I have some tips for you in determining whether or not otolaryngology is a good personality fit for you. Tip number 1 to consider. Otolaryngologists are the airway experts of the hospital. We are often called upon to intubate patients who have proven difficult to intubate by others. We can establish an emergent surgical airway when it's absolutely necessary. This begins as an intern. You should remember that not everything in life is predictable. You can be going about your routine, rounding on your patients when a nurse interrupts you to state that she's concerned her patient that underwent a thyroidectomy is having difficulty breathing. You can be sitting in your operating room at your training program's community hospital, waiting for your attending to arrive to perform a tonsillectomy when the OR nurse from the ortho room comes in stating, "We need someone's stat. The anesthesiologist performed an emergent cricothyrotomy, but the tube came out." These events are not regular occurrences, but when they do happen, you have to be able to manage the adrenaline surge that accompanies the event because a patient's life ultimately depends upon it. Tip number 2 to consider. This is along similar lines as what we discussed in tip number 1. From the beginning, you need to feel comfortable asserting yourself and managing difficult airways from time to time. Although rare occurrences, you may find yourself as an intern or junior resident having to take over the airway management from an emergency department attending, for example. First, you have to have confidence in your knowledge base to recognize that this clinical encounter is not proceeding optimally for the patient at hand, and you have to be professional enough to instruct others senior to you and sometimes even take over the management of the patient's care. I'm not stating that you need to be aggressive or outgoing or even loud. I'm simply saying that you need to be able to assert yourself because a patient's life again might depend upon it. Trust me when I say I have witnessed some of the most reserved residents, seemingly quiet residents, assert themselves when necessary and effectively manage an emergency situation. Finally, otolaryngology is a team sport. You must enjoy working well with others because we often rely upon other specialists and providers to comprehensively manage the conditions that we treat as otolaryngologists. And these are just a few points that you might consider when determining whether or not otolaryngology is a specialty that you can enjoy and succeed in practice. If you find my tips helpful, share them with your friends and continue to follow me at Dr. Gina Joe on Instagram, YouTube, Twitter, and LinkedIn.